Let us
Please
pray.
go ahead.
Let us pray. Gracious Father, we thank you for the opportunity that you have provided for the converge on this platform to learn something that will add value to our lives and adds value to humanity. Thank you for all the participants. We pray for the facilitators that will give us the fruit of thought, that when we leave from here, it will make us to be better pharmacists in our respective locale. This is my prayer in Jesus' name. Amen.
Amen. Amen. Thank you very much, sir. Once again, I say welcome to each and every one of us here. Reverend Dr. T, thank you so much for the prompt opening prayer.
You are most
So
welcome.
let me just briefly acknowledge the prayer. Everyone here is a dignitary. Everyone here is special. But because of what to call everyone by their names, but just know that you all are presence of the CIPA National Chairman, Dr. Joseph Madusa, FPSM. So you're welcome.
Thank
We
you very much.
have Professor Zukokbara in our midst. Prof, you're welcome, sir.
Thank you.
We have the CIPA National Account here. Host, we say hello to you. Good evening, ladies and gentlemen. Without wasting much of our time, because it's been a busy day for everyone, time to call on this presentation. And the presenter is no other person than pharmacist Fayemi Samuel Oluwaseun, B Farm, FPC Farm. Farm Samuel Oluwaseun is a certified family planning provider. He's a manager, Drug Information Center, Ahmadu Bello University Teaching Hospital, Zaria. He is the head, Monitoring and Evaluation Section, Pharmacy Department, Ahmadu Bello University Teaching Hospital. He is a member, Education Committee, Pharmacy Department, ABU Teaching Hospital, Zaria. He's a member, Hospital Multidisciplinary Team on Infectious Disease. So with a round of applause, I would want us to, electronic round of applause, I mean, you can also clap anyways if you don't mind. But I would want us to enthusiastically welcome our presenter for tonight's presentation. Pharmacist Fayemi Samuel Oluwaseun. Welcome, sir. You have the floor now.
Thank you very much. Good evening to us all.
Good evening, sir.
Okay, I hope I'm audible enough too.
Well, from my end, you are. Others can respond too, so that if there's any glitch, we could fix it.
Okay. Thank you very much. Okay, thank you very much. I want to say a very big thank you for this opportunity to present. I recognize especially the big wigs in the pharmacy profession and everyone who is present here today. I want to say thank you for this opportunity. I want to appreciate our very own Dr. Madu and our father in the profession, Professor Azuka Opara. I want to say a big thank you once again for this opportunity. Without taking much of our time, because today is indeed a weekday and a busy day for all of us, I hope to make the presentation as snappy as possible, not looking down on the importance of the subject of discussion. The subject of discussion today is micronutrient supplementation, a focus on zinc. once again, my name is Pharmacist Fayemi Sheon. This is the outline of my presentation. Be looking at introduction, nutrients, macro and micronutrients, micronutrient supplementation, zinc, which is the focus of our presentation today, clinical application of some clinical application of zinc supplementation, recommendation, and then we'll go to the references. As we can see, this is a baby that is ready to eat. But the reality is, this baby is confronted with both macronutrients and micronutrients, depending on the stage of development from 0 to 6 years. This baby is expected to be on exclusive breastfeeding, and then 6 months, and then subsequently, we start on additional feeding with the food that are complementary feeding with what we have at home. But then, whatever this baby eats or does not eat have a huge role to play in the development, both physical and mental, and even psychological, as the case may be, development of this child. So straight to the introduction. Nutrition is essential for growth and optimal body functions. A lot of physiological development, physiological functions are subject to the nutrition that we get. These nutrition are either macronutrients or micronutrients. The micronutrients are the nutrients that, this we should take note of, provide calories or energy that are required for our normal day-to-day activities, growth, metabolism, and other functions of the body. We get them majorly from carbohydrates, proteins, fats, and water. These are macronutrients. But the subject of today is micronutrients. These micronutrients, please, I hope I'm clear and audible enough. Okay.
Yeah,
Sorry?
You are audible.
Yes,
Okay,
sir,
thank
we
you
can
very
hear you.
much. Okay,
Can hear
thank
you
you
loud
very
and
much. Okay, thank you. Micronutrients are those components of diet that do not provide significant contribution in terms of calorie, in terms of energy, but they still play their vital roles in body functions of the body, in growth, in brain development, neuron development, neuronal connections, the development of cell-mediated defense system, and you get this majorly from vitamins and minerals. The micronutrients can be categorized into these three broad classes. We have the vitamins. By vitamins, we mean water-soluble vitamins, the vitamin B and the vitamin C. And we have the fat-soluble components of vitamins, the vitamin A, D, E, and K. These are usually obtained, we got them majorly from plant sources. Then we have macro minerals. Yes, they are minerals, but they are usually taken in somewhat large quantities. For example, calcium, a typical calcium supplement will be about 300 milligram, and you can take that almost up to 3 times a day. So these are macro minerals. We have phosphorus, we have magnesium, we have sodium, which is common in virtually every diet we take, chloride, potassium, sulfur. But then the focus of today is on the trace minerals, because they are, even though they are required, but in smaller quantities compared to the macro minerals. We are looking at iron, manganese, copper, iodine, fluoride, selenium, and zinc. And if we look at public health interventions, we see that there's a lot of focus on these trace minerals. For example, you look at iron. Iron there is a lot of focus on it for pregnant women and lactating mothers because of the vital role of iron and then the deleterious effects of anemia in pregnancy. Also look at selenium. Selenium is being promoted of late because of the high antioxidant activity it has and the other roles it plays in some of the chronic diseases that are associated with geriatric patients. And then zinc, which we know majorly, the zinc zinc supplementation is highly promoted for diarrhea in children because of its major role in maintaining the integrity of the GI. But the focus of our presentation today is to look at not just the role of zinc in diarrhea in children, but to see some other clinical relevance of zinc in the growth and development of our patients. Now, these are the sources of micronutrients. We have plant sources, we have animal sources, and we have other sources. Now, for the plant sources, we have whole grains. You look at rice, for example, with the bran. You look at wheat. You look at green leafy vegetables. You look at sunflower seeds, almond, cashew, banana, garlic, onions. These are plant sources of zinc. And we have animal sources of zinc. We have meat, we have milk products, we have eggs, seafoods, yogurt, liver, and so on. But then there are other natural sources of micronutrients. You have mineral water. For example, some of the water we drink, even bottled water, some are not, the companies have gone ahead to fortify them in a way. And in addition to just the water, you see some of them contain some of these trace elements, trace minerals. So you have mineral water, you have salt, you have processed foods, because some of them are also fortified with some of these minerals so that it is a way of supplementing so that you are not just taking those food products, but you are taking some additional micronutrients. Micronutrients are usually from external sources, as I've said, and then they can even be taken as ready-made medications, which is generally called supplements. So in the pharmacy, on the shelf, you can have zinc come as supplement, you can have selenium come as supplement. You have a lot of iron preparations with various salts to enhance absorption and so on. So we're zeroing in on zinc supplementation now. Zinc supplementation, zinc is a micronutrient. It plays a vital role as catalyst for a number of biochemical reactions. It's involved in DNA synthesis and building of proteins. It's highly involved in growth of cells, healing of damaged cells, required during rapid growth phase such as childhood, adolescence, and during pregnancy. It's involved in the senses of taste and smell. And that's why when excess zinc is taken, it has some effect on desensitizing the sense of taste. That's at excess level. Also, zinc promotes cell-mediated, T-cell-mediated immune function and helps in fighting infections like diarrhea, as we see in the case of children, diarrhea in children, also pneumonia, which is a respiratory tract infection, and then boosting of the immune system as we have the intervention in case of malaria. Now, in pregnancies and infants, it reduces the incidence of premature birth, decreases childhood diarrhea and respiratory tract infections, lowers death from all causes, and increases growth and weight gain. Now, this is a recommended dietary allowance. That means on a routine basis within a day, this is allowable. For adults that are 19 years and above, 11 milligram per day for men, and then 8 milligram per day for women. Or in pregnancy, we discover that women require higher quantity or a higher amount of zinc, up to 11 milligram. And then with lactation, we even have a much more higher requirement of 12 milligram. But the maximum daily dose of 40 milligram is okay. Now, as good as zinc is, there are factors that affect the concentration of zinc in the GI. Let's note that the absorption of GI takes place majorly in the small intestine. Zinc interferes with the absorption of iron and copper. So co-administration of zinc and iron preparations may have some effect on the absorption of either zinc or iron or copper. Now, high amounts of calcium and phosphorus in cow milk can lower zinc absorption. Fruits and vegetables contain lower amounts of zinc. Let me go to say that even though we have zinc from sources such as plants and from animals, it's on record that zinc is more from animal sources than from plant sources. So people who are vegetarians or those who live majorly on plants may not be benefiting much from zinc with respect to their diet being a source of zinc, except they have to take supplements. So, but beans, nuts, whole grains contain phytates. What this phytate does is phytates are phosphorus compounds. They complex zinc and then reduce the intestinal absorption of zinc. Zinc toxicity occurs majorly with zinc supplements rather than from meals, because the quantity of zinc in meals is not as high as what we have in supplements. Now, there are some conditions that require zinc supplementation. So I just picked a few of them, about 3 of them. One is in respiratory tract infections. Now, during COVID, for those of us who had the opportunity of working at the isolation centers where these patients were being managed, we'll see that one of the items on the regimen is zinc. And at some point, people were taking very high doses, but it was clear that with 40 milligram, you can actually get a good result. So whether a patient is zinc deficient or not, so we're looking at the serum concentration of zinc now. So when the serum concentration of zinc is checked and it's found that the patient is having hypo zinc level, zinc can still be given as a supplement to prevent and to shorten the duration of respiratory tract infections. But this is majorly in adults. Now, zinc more effective in children with lower zinc serum, that's zinc concentration in the serum, as compared to children with normal zinc serum levels. So that's for respiratory tract infection. The key point here to note is that zinc can prevent respiratory tract infections if taken routinely, and then it can shorten the duration of respiratory tract infections, especially those of viral origin. Yes, it can shorten the duration, and there's a lot of work that has been done, and this is confirmed. Now, other conditions where zinc supplementation can be required is the relationship between iron deficiency anemia and zinc. Even it's been found from literature that there's a strong association between iron deficiency and zinc deficiency. So most patients who are iron deficient are also zinc deficient. This is likely due to inadequate dietary intake of iron or zinc. And then there's also the possibility of dependence on food. People who live mainly on cereals, corn, rice. And then from a public health perspective now, you realize that most of the people are low income earners, or people who stay where in most of the low resource places. There's this challenge of feeding majorly on cereals, feeding majorly on corn, feeding depending more on rice. And most of people who have this kind of regimen of feeding are likely to be zinc deficient and also iron deficient, because their nutrition not only affect the fact that they are not getting enough zinc supplemented, but they are also feeding on phytates, which reduces the absorption of whatever amount of zinc they are able to get from from vegetables and some of these other sources of feeding. So there is a strong relationship between zinc deficiency and iron deficiency. Now, zinc supplementation in sickle cell disease. Now, this is actually of interest to me because sickle cell patients have some clear conditions. You look at, for example, anemia. You also look at poor growth and maturation of bones. Physical development generally is impaired. And then the immune system is compromised. So there is the likelihood of coming down with infections. Not only that, there is, I've talked, some of them could also come with complications that result in leg ulcers. So you talk about wound. In all these conditions, in all these issues, zinc supplementation play a lot of roles in promoting wound healing in case of leg ulcers, in reducing hospitalizations as a result of crisis. In one of the literature, it's been found that for patients who are supplemented on zinc, the incidence of vaso-occlusive crisis is lowered compared to those who are not supplemented on zinc. Not only that, the frequency of coming down with respiratory tract infections, which we know pneumonia is a very critical disease in sickle cell anemia. That's why sometimes they are, for prophylaxis, they are given pneumococcal vaccines for prevention of pneumonia. But we see that zinc supplementation can also contribute to reduce the incidence of the frequency of coming down with this disease. But of note, worthy of note is that in this review that was done, those patients that are below 5 years, there was not much result, not much help that zinc supplementation provided. And for further research, this is an area that we can look at, because these are the people who are more prone to respiratory tract infections and other opportunistic infection that is an outcome of low immune system in sickle cell disease. Also, it's been found that when we look at the issue of physical development, which is a very clear, a classical sign in sickle cell disease, yes, the length of limbs, the BMI is not actually affected by zinc supplementation, but the physiological processes of cell division and growth, zinc plays some role in that. So that's another area of attention for those of us who will be interested in research. But one clear thing is that zinc supplementation helps to overcome oxidative stress, which is an outcome of, for example, constant anemia exposes, there's a lot of metabolic stress as a result of the breakdown, hemolysis. There's a lot of oxidative stress as a result of infection. There's a lot of oxidative stress associated with vaso-occlusive crisis. Zinc play a lot of role in ensuring that the sickle cell patient can get benefit. And to my surprise, I realized that yes, there is an issue of determining what is the optimal dose that can be given to sickle cell disease to be able to say, yes, with this dose, they can be on routine zinc supplementation, just as they take their proguanil for prophylaxis of malaria, just as they take their folic acid for erythropoiesis and so on. Zinc supplementation will also play some role to reduce hospitalization and other conditions associated with sickle cell disease. I think I've talked so much about this already. The place of sickle cell disease often associated with poor growth and delayed maturation. I've talked about this already. So to wrap up the presentation, I would say that there is need to include zinc in routine antenatal and postnatal care and in sickle cell disease. Also, there is need for research to be done to actually ascertain the doses that will be optimal in sickle cell disease and to see what role it can play in the improvement of growth in this class of patients. Also, there's a gap of ascertaining the need for zinc in respiratory tract infections for children that are 5 years and below. In conclusion, zinc supplementation, like every other micronutrient, play vital roles in health maintenance and preventive medicine. These are my references. Thank you for listening.
We could give him some rounds of applause electronically. Pharmacist Fayemi, thank you so much for the very concise and precise presentation on micronutrient supplementation, a focus on zinc. Okay, so I'll just do a brief recap and I'm already seeing some hands up. Let me just do a quick recap. So he taught us tonight about micronutrient supplementation. He started by giving us some definitions, explaining the difference between the macro and micronutrients. And then he proceeded to zero in on one of the micronutrients, which is zinc. Supplementation, because our body doesn't give us enough, we must take it in. That is supplementation. And then he mentioned the diet and of course the supplements like nutraceuticals, through which we could get that. And then he proceeded to give us some clinical applications of the zinc supplementation to boost immunity. It helps in certain conditions like respiratory tract infections. In iron deficiency anemia, zinc could play a role, of which he emphasized that most times iron deficiency anemia is usually associated with zinc deficiency as well. This is an area anyone interested in research could go further into and get us more information as per the correlation between the two. And then, of course, he talked about the zinc supplementation in sickle cell disease, how it helps to overcome oxidative stress and minimizes the risk of vaso-occlusive crisis. He talked about the role zinc plays in diarrhea, in growth, and all other things he mentioned. Recommendation for the inclusion of zinc in the routine ANC, antenatal care, postnatal care, in sickle cell disease, and then the conclusion and his references. Thank you very, very much. Thank you. So I don't know. I'm already seeing 2 hands up. So yeah, you're already on the right track. If you have any comments, you have questions, you go on to raise your hands. So from my end, I'll start with Pharmacist Evelyn Akibe. Ma'am, you have the floor. I'll lower your hand since you have the floor now, so that I'll know how many persons are left. You have the floor, ma. Thank you. Pharmacist Evelyn, can you hear me?
Ma.
You have the floor, ma'am. I saw your hand up.
Yeah, actually, I'm not a pharmacist. I'm a dietitian, and
Okay, ma'am.
very interested in issues of micronutrients because of the hidden hunger issue. So I want to appreciate the presenter for finding time to work on this and then bring it to us to really have a clearer understanding. So it's like what he said in the relationship between iron deficiency anemia and zinc. I want to really support that because from other studies I've seen too, where there are deficiencies in iron, and when you look at it, there is also zinc deficiency, and we should be able to do more work and really come out with that. Then the issue of the food intake, most of our food are staples. So it's very important for us to encourage ourselves, our patients, to really go for the nutrients as in from food, and which will be like this crayfish, prawns, and other, easily affordable animal sources like egg. So these are the very good sources of zinc, and it will help prevent iron deficiency anemia in pregnancy and its complication. So that's my comment. Thank you very much for the presentation.
Oh, thank you very much, ma'am. Okay, you could also send your chats. I'm seeing some chats which I would read up. I'll read out for the presenter to handle them. But the second person that I'm yielding the microphone to would be Fambukola Ayinde. You have the floor, ma'am. I'm lowering your hand now because I'm giving you the mic.
Thank you very much, ma'am. Good evening, everyone. So thank you very much for that detailed and informative lecture. My question basically, I was informed some time ago that deficiency of zinc in children, especially children under 1 year old, is actually responsible for some reaction to immunizations. Because I had the practical experience, I have a daughter who actually had a reaction to immunization at 9 months. And during one of my clinic visits, I was informed that, not by the doctor really, just some parents and some caregivers, that most children who have deficiency in zinc and sometimes vitamin D are more prone to these adverse reactions to vaccines. I don't know if you have come across that in the course of your research or your literature search. Thank you.
Thank you very much, ma'am. Fayemi, I don't know if you would want to say 1 or 2 things about that before I call on the next person.
Okay. Well, I've not really gotten an information with respect to that, but what I can say from a little I've done on zinc is that zinc, because for adverse reaction, you are looking at hypersensitivity reactions and some other things that has to do with immune response. But the major role zinc plays is in the T cells, cell-mediated immune response. I don't know whether that will be related. First of all, maybe we'll need to look at which particular vaccines the patients or the children usually have such reactions to. But I think it's an area that we can look at generally. I will also do more search on that. But I can't really say per se what could be responsible for that. Yes. But zinc is involved with a lot of enzymatic activities. That's why it plays a lot of role in the immune system. Yes, I think that's what I'll be able to say for that. Then there was a question I saw on ocular health and zinc. Yes, zinc has some role to play with the retina. Sometimes even there's an eye preparation that is ocular, that's zinc, ophthalmic preparation that is just zinc. I know it's available, but that has to be on prescription and evaluation by an ophthalmologist before that will be required. That will not be related to zinc supplementation as we have looked at today. Yes. Thank you.
Thank you. Thank you very much, sir. I mean, if not anything else, your presentation is really raising a lot of research questions, which we could go back and read up, research further to improve our knowledge, and which would, of course, improve our practice via implementation. So I'm going to give the microphone now to DAE. DAE, your hand is up. So I'm giving you the mic now, and I'm lowering your hand. Thank you. You have the floor.
Okay. All right. Thank you. That was a very wonderful presentation being given. My question goes like this. I don't know from your studies or from your findings, I don't know if zinc has been shown to be found in breast milk. Then second to that, I don't know, are there any signs that we can actually watch out for when a child is deficient or when an individual is deficient in zinc, even though it's a micronutrient? And then for adults, are there other laboratory findings for us to really know, okay, if this person has adequate zinc or the symptom or the signs this person is presenting with, they have to do with low levels of zinc or high levels of zinc? Thank you.
Famfire, you're still there, right?
Yes, I'm still there. You know, if in the course of the presentation, I talked about the daily requirement for zinc, and you see that for lactating mothers, there is higher requirement of zinc for lactating mothers because the child will need zinc. So the lactating mother need higher amount of zinc, just like they will need higher amount of iron and some other trace elements. So yes, zinc can be found in breast milk. It's required for the infants via breastfeeding, yes. Now, signs of zinc deficiency. I think the major sign, as we will see, is that, especially for children, it's been found that you can't really, whether the child is, because we're looking at zinc now, when we talk about zinc deficiency, a higher percentage of zinc is actually in the bones and in the other tissues of the body. It is just a small amount of the total amount of zinc in the body that you find in the serum or in the plasma, let's say in the plasma. So laboratory finding for zinc would be to do serology and check what is the amount of zinc. That can be done. The amount of zinc can be done. And then also there's a direct relationship between zinc and copper.
Okay.
Yes, there's a direct relationship. So zinc, when there is lower amount of zinc, there will also be lower amount of copper. So that can also be a marker that can show that there is some level of deficiency. So, and this can apply to both adults, yes, and children. Now, for signs of zinc deficiency, it is because of its activity. The activity of zinc is majorly at the cellular level. So you may not really be able to pick it until you begin to see signs of, for example, anemia. When you begin to see signs of anemia, when you begin to see signs of oxidative stress and so on, then you may want to say, okay, let's check what's the zinc level. And then in most cases, you will find that the zinc level is low and there will be need for supplementation. Then when there are respiratory tract infections, in most cases due to viral causes, then you may need to just supplement, whether there is hypo zinc level or there is just normal zinc level. Yes.
Thank you very much. Well answered.
Okay.
Thank you.
Asking about hyper supplementation. I think aka zinc overdose.
Yes.
The person is asking for the signs of hyper supplementation of zinc. So it's just like zinc overdose.
Zinc overdose.
And then the second question is asking about when you mentioned.
I think the major sign, the effect on taste. That's the major toxicity. That's the major toxicity. But
okay.
Yes, that's the major toxicity that I know at the moment.
Okay, then another one is that you mentioned that zinc interferes with the absorption of iron. What do you advise on some nutraceuticals that contain both zinc and iron?
There is this belief that because zinc has some oxidative activity, it can help iron absorption because of this theory of ferric ferrous situation, and the ferric form of iron is more absorbed. So whatever has antioxidant activity, whether it's zinc, whether it's vitamin C, whether it's selenium, people want to combine everything just to increase the absorption of iron. But the issue is the major interaction now takes place at the point of absorption. So whatever we interfere at that point of absorption will have effect. But if it is possible, we should take iron separately and then take zinc separately if it is possible, instead of combining them together. And another thing is, if you look at the dose of zinc in some of these preparations, they may not be as high as 40 milligram, for example, that will have that significant effect in reducing the absorption of iron. Some of them, the zinc components may be very, very low. So you may not, clinically now, that's practically, you may not actually see that interaction taking place. I don't know if clear.
Okay, I believe you are. So I'll be yielding the microphone now to Dr. Oladele O. So you have the floor. and I will put your hand down. Thank you.
Thank you, Ma. Thank you, the presenter.
Thank you, sir.
Yes, I just have a comment and a question on the dosage of zinc.
Okay, sir.
As we see from the presentation and what I've read also, the RDA actually, as you said, is 11 milligram for men and 8 milligram for women. But
Yes.
in our day-to-day activities, and we in community pharmacy, we normally come across diarrhea in children, and the dosage for diarrhea in children less than 6 months is 10 milligram daily.
Yes.
And for above 6 months, we have 20 milligram daily. Then
Yes.
when there are some preparation of zinc, or let me say there are some zinc preparation in the market that you have 150 milligram per day.
Yeah.
So I want to ask, are we limiting the use of the dosage with this use of 11 milligram, 8 milligram to only supplement it on? So could we now say that when we have a case of either there is loss of zinc due to diarrhea, we will not be applying 8 milligram or 11 milligram? As a then, I think we can use higher dose. That I just want to ask, because using 20 milligram daily for children of 6 months and above, we are not reckoning with 8 or 11 milligram again.
Yes.
So my question is that, should we take it like that, or we are only limited to the use of 8 or 11 milligram per day as daily dosage for adult?
Thank you very much, sir, for this question. The recommended daily dietary allowance is actually like for a routine use. So that means if the person is going to just take zinc routinely, daily, not because there is diarrhea or you're trying to prevent a respiratory tract infection or you are trying to treat any condition, then this recommended dietary allowance can be followed. But for children who are having diarrhea, that's the standard dosing, 10 milligram for those less than 6 months, 20 milligram for children above 6 months. But even at the peak, for example, we have issue of COVID. When there was COVID, the highest, despite this severity of COVID, the highest the recommended dosage was 40 milligram. So taking 50 milligram or taking 100 milligram would be taking overdose in a way. Yes, would be taking overdose in a way. So if the person had to go high at all, for example, somebody who has a respiratory tract infection, 40 milligram would just be okay for that patient. Yes. Now, for children, we should just follow that 10 milligram for less than 6 months, 20 milligram for those above 6 months. Because for children, in one of the literature, those that were placed on 10 milligram routinely, that's even children and then adolescents, there was not much benefit that the 10 milligram gave. They actually required something a little higher, between 20 milligram and up to 35 milligram was found to be optimal. So I think 40 milligram would just be okay. Yes.
All right, thank you.
I don't know if I'm clear, sir.
Yes, you are clear. I got you. Thank you.
Thank
Still
you
on the
very much.
dosage, someone wants to know for the antenatal clinics,
Yeah.
what dose? Should they be taking it every day or once in a week? What do you advise from FIME?
I would say this actually requires some form of further study. But what we've seen, if they can take what the recommended daily dose, for example, for pregnancy is 11 milligram. So if you take 10 milligram daily, which is because that's like the preparation we have available in the market, most of it comes as 20 milligrams, especially the zinc sulfate, comes as 20 milligram, which is cod. So 10 milligram daily would be sufficient. If we are looking at it practically now, because we don't really have 11 milligram in the market, if for the purpose of supplementation. The other way is to take food. It's even advisable that you take food rich in zinc instead of looking at supplements, because the quantity of zinc that you will get from food sources are not as high as what you get from supplements. So for pregnant women, it's better to take food that are good sources of zinc. Yes, that's better, so that you don't overdose too.
Okay. Thank you very much, sir. We still have a hand up.
Okay.
Correle Tampiaco, your hand is up. I'm giving you the mic now. Are you there?
Yes, I'm here. Good evening, ma.
Good
evening, everyone. Thank you very much, Fayemi, for the presentation. Okay, so I have another question, and it still regards the zinc supplementation, and I want to know the duration. The duration one can actually, take the zinc supplements. Is it for like months? Can you take for some months, then you stop, or it's supposed to be like a continuation thing? Then secondly, there are different salts when it comes to zinc supplementation in the market. So I don't know if there's a particular zinc that's best absorbed, probably if you're not able to get it from your food every day. So is there a particular zinc salt to look out for when you want to buy like a zinc supplement?
Okay.
I mean in adults now.
Yes.
Thank you.
Thank you. I'll say that, first of all, when we look at supplementation, we're looking at something that you take daily. And let me still say, as a public health person, yes, it's good to go for the supplement, but we prefer that you take food rich in zinc. That's, you take zinc from food sources. This is very important, and it's good that we also let our patients know this, or our clients, as the case may be, that it is food rich in zinc. Yes, we have zinc sulfate in the market, which is the most readily available. There is the zinc gluconate too, is also available, but not as much as the zinc sulfate. So, but for every one of them, the zinc ion, right? I don't have the figures right now at my fingertips, but for the zinc, the elemental zinc component is either 20 milligram or 10 milligram or 50 milligram or 100 milligram. I think that's how most of the preparations come. Yes. And then for the issue of if you are going to be taking the supplement, if you put into consideration the recommended dietary allowance, you can actually take it every day, as long as it is falling within the recommended dietary allowance. You can actually take them every day for as long as you want, as long as you are not overdosing. Yeah.
Okay, so we have someone from the floor asking what dose of the zinc you recommend for growth enhancement. What dose of zinc you recommend for growth enhancement specifically?
Okay. Yes. Now, from the presentation, I said that when you are assessing for growth, you're looking at anthropometry, you're looking at the bone length, you're looking at the adipose fat, and so on. We are looking at the weight and height, BMI. Now, zinc does not contribute to improvement of the BMI. So that is one, would I say, a shortfall of zinc now. But when you look at the physiological processes, physiological development, zinc plays a lot of roles: cell development, neuron activity, neuron development, nerve connections. Yes, zinc plays a lot of role in that. Enzymatic activities, zinc plays a lot of role in that. But when it comes to the physical increase in length of bones, increase in muscle mass, and so on, zinc has little or no contribution with respect to that.
Okay, thank you very much. So, just as a feedback, it simply means that one shouldn't bother taking zinc just because you want to achieve a growth enhancement. It still boils down to what you said.
Yes.
The diet is enough.
Yes.
And if there's an immunity compromise, like where you have the RTI, or you have some other things that point to a deficiency, you can just go on it for some time to achieve that. And once you're healthy and good to go, just continue with your healthy diet.
That's perfect. That's perfect.
Okay, yeah. Someone asked side effect if it's too much in the body, and I know you've already answered that. You said that one of the most like what we can see most of the times in that regard is the loss of taste.
Yes.
Even though the body may still give other signs too. That could be checked out, but the most common one is the loss of taste.
Yes.
Okay. Then someone asked, let me see if it's a repeat. Can zinc salt be used in food fortification? If so, which is recommended combination? Is it with cereals, beverages, pasta?
If you look at especially the dairy products, baby milk, and infant formulas generally, zinc, iron, they are always included, and vitamins, they are always included. So, but if, for a wider public health intervention, just like we have iodine in salt and so on, zinc definitely is just like every other mineral, like calcium and so on. So they can be included in any of these meal. But to be able to look at which one is a carrier, I may not be able to say specifically which one will be a good carrier now. That may require some search. But definitely we should look at calcium. Calcium will interact with zinc, to complex with zinc. So anything that is rich in calcium may not be a good vehicle for zinc. It may not be a good, but any other one I think will be okay.
Okay, so it means that that's one, there is still room for further research, because even talking about the calcium thing, I know there are products that you have calcium max zinc 3-in-1 in a product. And it's still meant to achieve a purpose. It's not just like everybody takes it. There are certain situations that present, and then you have the physician going for that, or you have the pharmacist recommending that. Okay, so someone asked here if there's a relationship between zinc deficiency and infant mortality.
The major relationship is with respect to diarrhea. Is with respect to diarrhea. When there is zinc deficiency, diarrhea can become, it can worsen, prolonged diarrhea, and we know that diarrhea is one of the major culprits when it comes to infant mortality. So That's the major role. And then also respiratory tract infections. But unfortunately, from our study, we found out that there is little role that zinc plays in acute respiratory tract infection in children. Yeah. So, but that the major role is with respect to diarrhea. That is well proven. That's well proven.
Okay, so someone is asking what diseases can be treated with zinc. I know you've handled that, and that information is also on the slide.
Yes.
Talking about
Presentation, yes.
sickle cell anemia, talking about RTI, immune boosting, and stuff like that. It's okay. So, in the absence of any more hands
No,
up,
I'm raising my hand. Yes, I've been raising my hand.
I didn't see any hand up. Sorry, ma'am.
Yeah, my hand is raised. No.
You may have the microphone now.
Okay, thank you. Thank you. I wish to appreciate the presenter for a well-researched and well-presented paper on this topic. Very educative. Thank you. My concern.
Thank you, ma'am.
Concerns the phytates that you said is an inhibitor of iron and zinc. And you mentioned some of our food items that have that. So I feel that we need to advise our clients when we are counseling them, assuming they have that iron deficiency or zinc deficiency, at least to avoid some of those foods, like you mentioned beans and other ones. So it will be good also because most of those people I feel may be more on those diets and they wouldn't know that it's interfering with their iron level and that zinc level. Like tonight, I learned a lot concerning that iron deficiency so that somebody may be treating iron deficiency and be eating those foods that are interfering with the iron absorption because of the phytate that is in them. And I also know that soya bean has also that phytate. And most people may not know. And they tend to say if the milk they are taking is causing them some problems, they resort to soybeans plus other, they can also even giving it to their children. And that may be the cause of maybe their iron deficiency or zinc deficiency. So I feel that we need to advise people more rather than people thinking of going to buy zinc and to be supplementing in their diet. They can look inwards on what they are eating and know whether they will improve. Because you mentioned about the rice, people may be eating rice every time, beans, and that kind of thing, cereals. So I don't know whether there's any more advice that you can give on that so that people will be enlightened instead of asking of how they will be buying supplements to be taking zinc. They can improve on their diet and avoid those things that will inhibit the absorption of iron or zinc. So I don't know whether there's any more thing you can say about that so that they won't bother about going to be buying supplements.
I think you've actually hit the nail on. Yes, you've hit the nail on the head. We should look inward before we start supplementing. And then some of these things are actually products of the diets that the patients have been on. So there's need to advise properly on how to manage our diet and then the drugs that we give so that we get good results from our interventions as healthcare providers. Thank you very much, ma'am.
Thank you.
It's been a night. Fayemi, thank you so much for your patience and your, thank you so much. The presentation, the way you handle the questions. Thank you. Keep it up. Before we call it a night, I would like to give the microphone now to the daddy of the CPAN house, Dr. Joseph Madu, FPSN. Sir, I don't know, are you here? Can you hear my voice? We would like to hear your voice before we retire for the night.
Hello?
Hello, Dr. Joseph.
Okay, good
You have the microphone.
evening, everyone. Please. Yes, can you hear me very well?
Loud and clear, sir.
Okay, let me thank you for giving me an opportunity to speak. Most importantly, I will thank the presenter, pharmacist Fayemi, for honoring the nutrition support pharmacists to make this presentation. I can see that the presentation is concise, clear, and straight to the point. So I want to thank him, and I want to thank everyone who has found time to be at this meeting tonight. I want to say that nutrition support pharmacists, they have not really been a very active arm of CPAN. And we have been looking forward to making that specialty group very active until pharmacist Ifeoma Moma came on board, and I can see how active she has been with her team. So we in CPAN really want to thank her, and we want to encourage everyone, especially the pharmacists in our midst, because I saw dietitians, I know that we made the announcements even on WASPEN platform. But of course, we know that non-pharmacists cannot be part of nutrition support pharmacists. But the pharmacists, especially persons like pharmacist Fayemi, we still like to have you more so that you help in building this specialty arm of CPAN. I didn't have enough time to ask my question, but maybe that's for another day, because I learned that when someone is having gray hair, of course, we know that gray hair is a blessing, but I learned somewhere that is sometimes due to deficiency of zinc. And I started developing gray hair. I started taking zinc supplements, and my hairs have refused to turn dark. I wanted to know why, but I can see that it's already late. Let me just say, let it be for another day.
It's okay, sir. Thank you.
Again, thank you very much, and thank you, everyone. God bless us all.
Thank you very much, sir. I'm grateful, sir.
Thank you very much, sir. But Fanfare, I don't know, do you have something to say about this, his gray hair and the lateness to turn into black again?
I think Dr. Joseph Vadu is becoming wiser by the day. But because I know people say gray is associated with wisdom. But sincerely, I'll need to search and see. But we know that everything that has to do with cell division and so on, zinc plays a lot of role with that. So, but I don't have a direct answer right now. I'll do more search. Next time I'll be able to answer. Thank you, sir.
All right. Thank you very much. Thank you, our moderator. You did wonderfully well.
Thank you very much, sir.
Let me
use this opportunity to appreciate the nutrition pharmacist specialty group. So now I believe good night, everyone. I believe the slides will be shared. The slides will be shared on the platform so we could all access it. Thank you. And have a good night rest, everyone.